Diverse audiences pose a very special challenge. One of the difficulties is one size doesn't fit all. You need to target the message for the proper audience. In my work, I do a lot of work with HIV and STDs, and we're often trying to communicate at the same time with gay men and Black urban women. These are very different populations, and you need to understand your population carefully to target the message properly. One example that comes to mind about the importance of being very clear in your communications messages are messages that we send out to people about who's at risk for HIV infection, how do you get HIV infection. There can be a lot of nuance there. Was it a mucous membrane exposure? Did you have an open wound on your skin? What kind of sex did you have? Where did you inject the drug? If we get into those details, you lose the audience, they're confused, and they don't have a simple message to remember. When you're talking to people about risk in something like that, I think I've found, and others like myself have found, it's better to start with messages that are just very clear and very simple. That really HIV is not that easy to get. However, there are certain things that you do that will put you at high risk. Sex, using injection drugs, and receiving blood products. If a person thinks they may be at risk in one of those categories, they can go out and get more detail about that. But we need the message to get across to folks so that they can very quickly tell, is this something I'm at risk for or that I'm not at risk for?